You're talking about a person who is so injured that they will never be able to work again. How do you even talk about a settlement in those kinds of cases where there's going to be needs for the rest of a person's life?
So when you're looking at settling a workers' compensation claim, you always have to look not only at the risks that the injured worker has going through the process and staying within the workers' compensation system, but you also have to consider what their risks are once they leave that system. And so what you're touching on is potential future medical costs. How are they going to pay their bills? These are all things that you have to look at before you decide whether or not a claim can settle. Because if this person's never going to work again, they're not going to be able to pay their bills on, a $50,000 settlement or a $100,000 settlement. A lot of people might think that's a lot of money, but if that money has to get you 30 more years, it's nothing. If you have a very complicated medical condition that you're going to need expensive treatment for, if you don't have a way to pay for those medical bills, if you settle your workers' compensation claim and as part of that settlement, you're closing out your medical benefits, you're on the hook for that. So you have to be very careful.
Now, of course, there have been settlements that you and I both handled where the indemnity portion of the settlement is moving forward, but the medical portion is left open. That's a possibility, is it not?
Yeah, so in the sort of catastrophic case you mentioned at the beginning where this person's clearly never going to work again, that's the most common time where we see those kinds of settlements, where they kind of calculate how many years would they really expect to be paying wage loss, and they pay a discounted rate in a lump sum now to close out that risk, and then the injured worker has money that they can take and invest and potentially make a lot more money over that same time frame. But they'll keep paying the medical expenses because they'd be too expensive or uncertain to close out.
Now, if the client is on Social Security disability and is a Medicare recipient, somewhere along the line, the federal government figured out that the insurance company here in Pennsylvania on this particular case is about to throw a curveball to the federal government to cover this individual's medicals for the rest of their life, and they decided that they have to be part of the settlement in order to make it happen. Talk about that.
We're required to consider Medicare's interest in every single claim that we settle, and Medicare actually will review Medicare set-aside arrangements when the person is on Medicare and the settlement is $25,000 or more.
There's two things that we have to be concerned about when we're involved with a Medicare set-aside. The first is it's complicated. You have to decide what can be paid, what can't be paid. You can't use it for personal things, et cetera, et cetera. So we always ask for an administrator, someone who's familiar with it, who's paid for by the defendant, and can handle the paperwork involved in this medical set-aside. Agreed?
Yeah, I always want professional administration for a Medicare set-aside. That there's reporting requirements and paperwork that has to be submitted to CMS every year, certifying that you're appropriately spending that money. There's cost containment concerns, meaning when you go to the doctor and you get a bill for that service, workers' comp doesn't pay the same amount of money that Medicare would have paid or what private health insurance would have paid. You want to make sure you're paying the right amount for that bill. So a professional administrator can determine exactly how much needs to be paid from the set aside for each piece of medical care that you're going to need to make sure none of that money is misappropriated so that Medicare doesn't down the line try to deny any of your medical treatment.
You know, a medical set-aside is a rather complicated situation when you're settling a case because you have to make sure the important things are covered. For example, if the client is on certain medications and for some reason Medicare doesn't include them in the settlement, this presents a problem. So you have to carefully go over the set-aside term by term to make sure that your client is covered. And if it starts to get into the six-figure number for these set-asides, is there any problem, in your opinion, for the employer to request and get a settlement that would involve payments in each year smaller than a lump sum of money that has to be put up?
So Medicare does allow the funding of Medicare set asides by annuities. They have certain guidelines that you have to follow for that, but certainly that can be done.